Understanding cancer can be tricky, but it is important. Let's explore what cancer really is. Cancer is a set of related diseases in which cells of the body begin to divide uncontrollably. Cancerous cells ignore the body's signals to stop dividing, resulting in a massive amount of unneeded cells. These cells become progressively more abnormal, and old or damaged cells survive when the body would normally destroy them. These new masses of cells are called tumors. Malignant tumors are cancerous and can form in any of the body's tissues. They can spread into nearby tissue or break apart and travel to other parts of the body. The brain and spinal cord are no exception. There are several types of cancers that can develop in the brain or surrounding tissues. Let's explore some of the different types. One of the largest categories of brain tumors is gliomas. This is a general term used to describe tumors that start developing in the glial cells or non-nerve cells in the central nervous system. The three main types of gliomas are astrocytomas, oligodendrogliomas, and ependymomas. Astrocytomas affect the glial cells called astrocytes. 2 out of 10 brain tumors are classified as astrocytomas. These tumors can spread widely and blend with other types of normal brain tissue. It is rare for them to spread beyond the brain and spinal cord, making them difficult to remove surgically. Oligodendrogliomas start in cells called oligodendrocytes. These tumors typically grow slowly, but like astrocytomas, they can spread into other tissues and are unlikely to spread beyond the brain and spinal cord. Oligodendrogliomas account for only 1 to 2% of brain tumors. Ependymomas are tumors that start within the ependymal cells. These tumors grow in the ventricles of the brain and spinal cord in adults. This type of tumor is more likely to spread to the pathways of the cerebrospinal fluid. However, they only account for approximately 2% of brain tumors. Out of all of the types of gliomas, ependymomas have the greatest chance of being successfully removed with surgery. There are more types of brain tumors than just gliomas, so be sure to speak with your doctor about what type you have. There are several forms of treatment available to treat cancer, including surgery, radiation therapy, and medication. However, treatment options depend on the size, type, and grade of the tumor. When considering treatment options, it is important to consider other factors such as whether or not the tumor is putting pressure on important brain structures, if it has spread to other tissue or parts of the central nervous system, and the patient's overall health. Some signs and symptoms of brain tumors include, but are not limited to, sudden onset or change in headaches, unexplained nausea and vomiting, vision or hearing problems, difficulty with speech, or seizures, especially in those without a history of seizures. If you or a loved one are experiencing persistent issues that concern you, please make an appointment with a doctor to address them immediately.